Good morning, everyone, or perhaps I should say good afternoon. Welcome to Medcan Presents. Today's webinar in our monthly series is the future of travel, safety, planning, and other considerations, hosted by Dr. Aisha Khatib, Medcan Clinical Director of Travel Medicine. A little bit about Dr. Khatib, and then we'll launch in. The format today is Q&A, so we'll ask 10 questions of Dr. Khatib, and then turn it over to audience attendees who can ask questions of themselves, through the Q&A function or the chat function on Zoom. Dr. Aisha Khatib, Clinical Director of Travel Medicine at Medcan, is also an assistant professor in the Department of Family and Community Medicine at the University of Toronto. She is trained in both family and emergency medicine and specialized in travel and tropical medicine. Her research interests have been in COVID and travel. How are you doing, Dr. Khatib?
Great. Thank you, Chris, for having me on today.
Well, thanks for doing this. I know you are so busy with all of the exciting things that you were just up in Northwest Territories fighting a COVID outbreak. And then what I wanted to hear about a little more is this study you're doing on dogs and COVID, which ideally actually ties into the premise of this webinar, because what it does is make travel easier, I think. Like, can you tell us about this dogs and COVID study you're doing, and then we'll go into the questions.
Yeah, so actually there has been scientific evidence that dogs can actually sniff COVID, and they're quite sensitive at it. So the sensitivities are between 80 to 100%, and these are studies that have come out of the Netherlands as well as Lebanon. And we already know that dogs are useful for sniffing other things such as cancer, epilepsy, and drugs. And one of the things that's motivating our study is the ability to use dogs to sniff COVID at places like borders and airports and mass gatherings. The efficacy rate of them being able to sniff is something like up to 250 per 15 minutes in regards to samples. And so what we are looking at doing is validating the ability of these dogs to sniff COVID by using samples collected from various assessment centers around Toronto. So it'll be interesting to see, and it has you know, like huge real life potential implications and uses for public health. And it would potentially be a way to move away from testing if there's another way to screen for COVID.
I have to ask, as a dog owner, I want to know if my dog is qualified for this. So what are the breeds of dogs that you're using?
So the dogs that we'll be using for the study particularly are going to be like police trained dogs. However, there have been reports and studies using kind of lay dogs trained up in various countries. And so, you know, various breeds can potentially be trained to do this.
And are they actually sniffing? Like, what are they detecting? What do you think?
So what we basically collect is sweat samples from humans. So we'll collect samples from their face and their armpits and whatnot. And those are considered to be what we call volatile organic compounds. And so based on that, there may be some difference for those who are positive for COVID versus those who are negative. And there's actually these sniffer training machines where these samples are basically run through, and the dogs are trained up to smell these samples, and through classical conditioning they're conditioned to the positive samples. And so that's basically how they are trained, but it's based off these volatile organic compounds and that they're able to differentiate a smell.
And so the thinking is, if we are, you know, returning from wherever, then perhaps we can, instead of, you know, going through the inconvenience and everything of existing tests, we can just get sniffed by a dog, perhaps.
Yeah, so in the same way that dogs would be sniffing for drugs in the airport, it would be the same idea. They'd be sniffing for COVID, and potentially if they pick up somebody, then that person could potentially be rapid tested to see whether they're positive or not, and then that would streamline isolation based on that.
And you said 80 to 100% accurate.
Yeah, it's pretty impressive.
That is amazing.
Yeah.
That's so great. Okay, so let's move into the question period of this, or my questions, our questions, which some of these came in advance from webinar attendees. And then some of them are just our own content team here at Medcan's curiosity. So long-term prognosis. Before we get into anything, how long do you expect travel to be as inconvenient as it is today? So this actually is a question. So my company, not my company, but this is the question asker's company. My company has been putting off travel and encouraging virtual meetings unless an in-person meeting is absolutely necessary. I am itching to get out there and meet with clients again. How long do you anticipate that travel restrictions will last? When, Dr. Khatib, will things get easier?
So this is a hard question to ask because it's kind of asking me to predict the trajectory of the pandemic.
We're putting you on the spot.
Right
the
now,
hardest question right off the top.
based on the hit to the airline industry and past trajectories for recovery, we're looking at, and so if we look at the actual hit to the airline industry last year, they were about 60% down compared to 2019 and their regular levels. So it's a huge, it's a huge delay in kind of where we're at. And even up to this year, I think it's still we're below capacity at around 43 or 47%. So if you look at the trajectory for how long it would take to recover from that, the airline industry is looking at a trajectory at somewhere around the end of 2023 or the early 2024. Now, this is based on kind of how things are going right now with the introduction of vaccines. As we know, the pandemic has been dynamic. So there are things that have come up that have been new for us, such as the variants, right? This was a whole different ballgame. However, the other advantage is now that we have vaccines, that's something that may help things kind of recover as well. As we know right now, the world is only about 47% vaccinated. And so that may still be challenging in regards to development of new variants and in future at-risk populations. So how long will the inconvenience last?
Sorry, Dr. Khatib. So the thinking there, the 53% who aren't vaccinated represent a pool where variants can develop, basically. That's the logic there.
Well, variants can develop as well as them potentially be severely ill, and that can destabilize a healthcare system. And as we've seen, it can destabilize an entire community and city, and economic processes associated with that.
Okay, so can you give us sort of a date, do you think, or
so I would say,
come back to the question.
Things will probably be inconvenient until at least the end of 2023 or early 2024 is what I'm thinking in regards to, what we were at pre-pandemic levels. If we're looking to kind of get back to a similar level, based on the trajectory, that's what they're saying is it's probably going to be not the easiest until about then.
One of my friends works for a private equity company, and basically every week he was gone. He was based in New York City. He was gone from Monday until Friday, traveling from place to place, like Des Moines, Iowa, to Omaha, Nebraska, like small American towns, place to place to place, meeting clients, and he loved it. And it's all virtual now. And this is sort of, I think this is a question a lot of people are asking. The client meetings, the client interaction is it's how business gets done often, and a lot of that stuff is on hold. So now bonus, any prediction on when the U.S. land border will open?
Right. So right now the U.S. land border is closed, I believe, until October 21st, and every month it seems to be pushed out by a month or so. I suspect, based on trajectory for vaccine rates, probably maybe by summer next year, if not earlier. But again, I don't have complete control of it. I think there's a lot of politics and economics involved with that decision. But I suspect, given where things may go, obviously the US is in a little bit of turmoil right now with their COVID numbers. And I think it'll depend on again, them and their vaccination rates and what they kind of decide as well. I suspect probably not until probably the summer of next year, though.
It is, gosh, speaking for people in the border communities, the Niagara Falls, the Windsors, the Sarnias, I think it's been tricky. Okay, moving on. Insurance. A lot of airlines are offering additional medical coverage as an incentive to fly. If I have out-of-country medical insurance through my health insurance plan, will that cover me? Or will I need additional coverage that is specifically for care of COVID-19? And before we get to Dr. Khatib's answer, I should caution everyone should check with their insurance here. Like, we are not providing medical advice. We're not providing insurance advice. But in general, Dr. Khatib, how does this go?
Yeah, Chris, I think you make a good point, is that every medical insurance plan will be different. So I think it's really important to understand that there is a lot of variability in what's covered and what's provided. For example, some insurance companies may help cover trip interruption or cancellation due to COVID, but they may not cover medical care for COVID and things like that. So I think it's really important to take a look to see what your insurance will cover and see if you can get additional coverage specifically. For example, if in the case that you become ill with COVID specifically, or whether things like repatriation and trip cancellation or interruption. It'll also depend on timings for when you booked and when you got the insurance, right? So for example, if you buy something where, for example, there's a fourth wave surging and you're well aware of the risks associated with that and buy it kind of within that time frame, the coverage might not cover you because you're already kind of at risk. Whereas if you had bought your insurance package or your flight or whatever your trip was before, they may say, well, this was not predictable at that time, and so they may cover. So again, it's worth having that look at the fine print, and if you're not sure, you should call the company and find out what coverage they offer.
Perfect. Vaxzevria, one of the new names for AstraZeneca. Well, not one of the new names, the new name for AstraZeneca. I've heard that some countries won't accept AstraZeneca Vaxzevria to qualify as fully vaccinated. Is this still true? And does this matter? If I had a second dose of Pfizer, Comirnaty, or Moderna Spikevax, because all that's being asked to show is the proof of second vaccination anyway. Do you know what this question is asking?
Yeah, for sure. And I think this is a big concern for Canadians, right? Because we have had the mixed vaccine schedule here, where we have had Canadians firstly vaccinated with AstraZeneca and then followed by an mRNA vaccine, which, based on the evidence and studies that we have had, this protects you and it was safe and was a reasonable option given the risks that we're starting to develop with the AstraZeneca vaccine that were kind of being brought to light. And so if you look at the numbers, it's about 3 million Canadians who actually received the AstraZeneca vaccine first and then may have followed it up. So most countries will consider, and I'm going to talk about the US specifically, because I think that's a big concern for people. The US considers 2 doses of the same vaccine to be considered a full vaccination schedule. However, and there's talks right now, like Theresa Tam is kind of in talks with the US right now, because there are lots of countries who have used mixed vaccine schedules because of the fact that they didn't have the availability of the first vaccine first off, or because of risks associated with it. And there is evidence to show that it shows protection and that there was safe. So it is being reviewed, and the CDC, particularly in the US, are going to be kind of examining that to say whether or not this is going to be acceptable for people coming into the US. Likely it is, and really they're looking at kind of a full vaccine schedule. Now, that being said, the question is whether you will be allowed entry into the US if you don't have the vaccine. And that's what people are worried about. Like if you don't have two of the same vaccines, you will still be allowed entry into the US if you have a mixed vaccine schedule. And the reason for that is that on top of looking at whether you're double vaccinated, they are also requiring a negative test up to 72 hours before arrival into the US. And that's standing for everybody, whether you're vaccinated or not, because the reality is you still have people entering the US who are not vaccinated at all. Right. And so how are they getting in? And so it's the same idea, is that you still need to be tested. And as long as you have a negative test before the 72 hours of your arrival, you should not be denied entry, despite the fact of whether you're vaccinated with two of the same or two different vaccines. The difference would be potentially in different countries, quarantine schedules. So if you're not vaccinated, so for example, if you're coming into Canada and you're not vaccinated, you may be required to do extra testing and or quarantine until that extra testing is completed. So that would be the difference. Whereas if you're vaccinated with the two vaccines, you're kind of given that out of jail free card type of thing.
Fantastic. Okay. Okay. Thank you for that. Least bad option. So let's say you and your loved ones are going absolutely stir crazy in Canada and need to get away for a vacation at some point over the winter. What is the least inconvenient warm weather country for Canadians? Where would you go? And when we say least convenient, we mean where are you not required to quarantine once you're there based on perhaps testing? You know, what is the least onerous testing regimen? And let's assume that the travelers in this case are fully vaxxed.
I would say the US is probably your safest bet in regards to going to somewhere that's warm weather. I mean, obviously you want to be cautious because their numbers are surging. And you may potentially, if something else happens, if you have an injury or any other medical issue, will you have access to healthcare if their healthcare system is being overwhelmed in certain places? But in regards to warm weather options with simplicity, given that you're double vaccinated and you still will require a negative test to go, as well as to come back into Canada, I would probably say there's lots of warm destinations in the US, which would probably be the most convenient. When you're looking at places like the Caribbean and you're looking at places kind of more beyond that, their travel restrictions are a lot more volatile. So things are changing fast in a lot of these regions. A lot of these regions like the Caribbean or Latin America or Asia are not fully vaccinated, or they do have very low vaccination rates. So you're potentially putting yourself at risk. And the other thing is, for example, if you become positive, perhaps while you're there, it will be difficult for you to come back. The other thing is, how easy is it for you to find testing for you to come back? Because you will need a negative test to return back to Canada within 72 hours. And I mean, that's widely available in the US. You know, you could go to Walgreens if you needed to, type of thing, to get testing done, you know, in a short time frame. So whereas in some of these other places like the Caribbean or whatnot, it may be more challenging to get. And like I said, a lot of these places are still quite unstable when it comes to how they're handling with the COVID situation.
And is there a US state, you know, Florida had its flare up, which I think they're on sort of the other side of, but is there a state, like, is California the best warm weather option? Louisiana, North Carolina?
I would not go to Louisiana right now.
They're
in a little bit of trouble.
That's a good,
Yeah, so a lot of the southern states are struggling. You know, they're at capacity, their numbers are high, they're not really following mandates, their vaccination rates are low. So they're higher risk already. You know, there's places like, it depends where you're going, right? So if you're looking at places like Hawaii, for example, Hawaii is quite strict about their who's coming in, who's being vaccinated, being tested there and kind of testing out. So that, for example, would be somewhere if you're desperate to go somewhere, you know, as long as you're kind of strict within that. Places like Florida, I mean, it's isolated, it's an island, so it's easier to kind of control those numbers, right? So, but they will be strict about that. You know, people will be planning on going to Florida. People will be planning on going to California. The snowbirds are planning on traveling, and, they were already traveling last year despite travel restrictions. So I don't think it's really going to stop them from going this year. But I think it's necessary to take the precautions as needed and be aware of the risks associated with travel.
Yeah, okay. So yeah, Hawaii is interesting. Plus has a lot of attention, I think, as a result of the White Lotus. I don't know if you watched, I don't think you have time to watch TV maybe, but the White Lotus was set in HBO show set in Hawaii, which was great. So speaking of snowbirds, I'm a snowbird, not, but the question asker is a snowbird preparing for the first time in a year to fly south to a condo in Florida. What non-obvious precautions should I be taking before our trip? So testing, insurance, these are the kind of obvious things. Is there anything that you would say or flag to do?
Yeah, I mean, first and foremost, like, get your flu shot, right? I mean, it's winter season. You're going to be exposed to different viruses now that people are out and about. People aren't distancing as much. And the other viruses are starting to recirculate. We are starting to see other respiratory illnesses pop up, such as flu. And so compared to last year, where everybody was really isolated, they weren't really mingling. So you didn't really see those respiratory viruses pop up. So, get your flu vaccine. I think that would be the first and foremost precaution. The other thing would be queue up yourself medically, ensure that your dental and your eye vision is all sorted out before you go. Ensure that your full medical is complete and that there's nothing pending or anything acute potentially that could go wrong there, so that when you are there, you're less likely to need to seek medical care, right? Because it is a high likelihood that the medical systems there may be overwhelmed and you may not have access to that care. And so I think those would be the types of things that I would recommend, kind of preparing yourself for, making sure you have enough of your own medications and extra, making sure you're queued up medically before you go. And that includes your dental, your vision, your medical checks and whatnot, especially for people going down. They may go down for longer periods this year, just given the inconveniences of going for a shorter trip.
Longer periods. There are limits in the back and forth that's available as well now, and so that's
with decreased flights, right? Absolutely.
Insurance plans have, I think, just speaking from the experience of relatives. Okay, great. So this is one. Once you are actually traveling, we're facing a 6-hour transatlantic flight. What non-obvious things might we consider doing to minimize our chances of contracting any viruses, including COVID, while we're in the airplane?
Yeah, so again, like, risk of COVID transmission on an airplane is relatively low. However, the risk still exists. And one of the biggest things that have shown to make the biggest difference in airline transmission of COVID is masking. So, when we look at when masking was implemented in airlines, that's when we saw a huge drop in COVID cases on airplanes. So the longer and better that you keep your mask on during the airplane, the less likely that you are to contract something. Now, this applies really for things like, for example, mealtime, right? Where all these meals go around and all the drinks and snacks go around, and everybody takes off their masks at the same time. And they may have their mask off for a good 15 to 30 minute period. That's a high risk time period. So, I mean, you'd think that they would try to potentially stagger meal times between rows or stagger odd and even numbers. But I would say is, if they're not doing something like that, then, and I would recommend doing that yourself, is staggering your meal time potentially from other people, so that not everybody has their mask off at the same time to be eating. So that would be probably one of the biggest things that, I personally would do, given to decrease that risk of exposure to other things. The other thing would be, obviously, staying hydrated, making sure you're well rested, washing your hands frequently, wiping down certain surfaces that you're going to be exposed to. All of these are going to make a big difference. The other thing is distancing. It's hard to distance on a plane. And I think the worst time and the most high risk time where you potentially could be at risk is there's a couple things. Movement on the airplane, right? When you have people all lined up to go to the bathroom potentially, or deep boarding, right? So deplaning. That's when the engines are turned off. That's when the ventilation systems potentially are turned off. And then you're sitting there on the tarmac, the ventilation's not going anymore, and you're sitting there, everybody's standing up, trying to get their stuff. They're all close quarters together. So being patient, I think, is really important, and trying to really give others space, give yourself space, and wait to allow time in between to kind of deplane with as much distancing as possible.
Fantastic. That is.
The other thing I would say is the type of mask that you wear. Right.
Okay.
I think it's really important that people are wearing either like a medical surgical mask, or at least a double, triple layer mask. Gaiters are useless. Anything with an expiratory valve is useless. Like these, I've seen people wearing these thin, flimsy things that look like, like it looks like lace almost. I mean, that's absolutely useless. So, wearing an appropriate mask that fits snugly over your mouth and nose. It doesn't have to be an N95. It can just be a regular surgical mask, but it should prevent any kind of leak in space. And it should be, a clean and fresh mask.
Amazing. Okay. Yeah. Thank you. That is the staggering the meal times. I hadn't heard that, and that's it. Perfectly logical and makes total sense. Okay. Preparing for the worst. I am hoping to bring my family to Mexico this winter, the question asker asks. If one of us gets COVID-19 while we're down there, what happens? Okay, so this is, so mild case, symptoms done in 3 days. When could we travel back to Canada? And then the worst, serious case, hospitalization required. This is what is the worst case? Would we be able to travel back to Canada with COVID if we're on a ventilator or something?
Right. So first of all, with like mild case with symptoms, for example, even if you are vaccinated and you get COVID and you develop mild symptoms, you still are required to isolate a minimum of 10 days from the onset of symptoms. Okay. Doesn't matter if your symptoms resolve within 3 days, you potentially could still be shedding virus and still considered to be infectious. That infectious rate and that transmission rate goes off substantially after 10 days. And so that's why there's that 10-day isolation period.
Okay.
Now, a couple things that are tricky. Once you test positive, you can actually test positive for up to 90 days, even though you're not infectious or transmitting virus anymore, because potentially the PCR tests that are required for travel or proof of travel potentially could pick up dead virus. And you may not be positive or you may not be infectious, but the airlines don't care about the science and the governments don't care about the science. They want to basically just see that result. And so they may deny you entry. Now, obviously, this became an issue. There's been several instances where people have had COVID abroad, they isolated, they were fine, and then they tested positive and they weren't allowed on the airline, et cetera, et cetera. So things were changed last year. The guidance was changed back in February. Essentially, for Canada to come back into Canada, if you have a positive test, a minimum of 14 days prior to travel, between 180 and 14 days prior to travel, and you are asymptomatic, they will let you travel. Okay. But if you are symptomatic or test positive within 10 days or within that 14 days before travel, you will not be allowed to travel. So you have to wait a minimum of 14 days. Okay. In the case of hospitalization, if you actively have COVID and are hospitalized, you will not be allowed to repatriate back to Canada. Okay. So in a case of hospitalization, the isolation period becomes 20 days. So they likely won't be able to bring you back for that first 20 days. They may consider after that, if they deem that you're not really an infectious or transmitting risk, they may consider repatriation. Again, that really depends on the company you're dealing with and the insurance company, et cetera. But otherwise, no, most places will not repatriate you if you actively have COVID.
So there, like that is, you could be trapped essentially.
Absolutely.
20 days. I mean, 20 days is enough for COVID to run its course, actually.
Yeah, I mean, and the other thing to think about is the challenge with like systems being full. Like one of the reasons I was deployed up to the Northwest Territories is because Alberta is surging and they have no capacity for beds. And usually sicker cases are transferred down from the Northwest Territories to Edmonton or Calgary, and they actually had no capacity. So they were sending the Red Cross up there to keep cases up there, which is, it's challenging because Yellowknife has 4 ICU beds and 2 of them were full.
Gosh.
And so the capacity there was really, and you think that this is happening in various states across the US and different places around the world. So that's the other thing is, yes, you may get COVID and whatnot, but where are you going to be transferred to when everywhere else is overwhelmed? Mm-hmm. Right? So that's the other issue.
Important considerations.
Yeah.
We're starting to get short of time. I want to work through the next couple. So resources, what's the best website out there to learn about travel restrictions in multiple different countries? Alternately, if you were in a position of having to prepare for a trip that bounces between numerous different destinations, how would you learn about the travel restrictions at those places?
I think there's lots of good sites. The travel.gc.ca is a great Canadian-based one, and kind of following Canada.ca has a lot of the information for travelers and restrictions and requirements. The CDC travel website is a great website as well, looking at kind of the different multiple countries and restrictions. They may not always be updated as often, and so the other thing would be looking at country-specific websites for their visa requirements or entry requirements and airline requirements. Unfortunately, nothing's standardized. So that's the issue, is that you really have to go in and do your research. I specifically use Shoreland Travex, which is a clinical decision-based tool resource that travel practitioners use. It is subscription-based. Anybody can subscribe to it. It basically gives me a summary up to date of what's happening in every country with any disease, essentially. So I can pretty much look up what's happening in regards to infection rates and in regards to security issues, in regards to political upheaval and that type of thing. So that's where I'm getting my information from. And that's where I mostly am advising people when they come through for their travel consultations. So that would be the best thing, is if they're looking for a resource, book a travel consult. This is our job. This is our specialty. We're in it. We're seeing things change. We're getting the information daily. We've got a huge network across the world that we're getting feedback from every day. So I know what's happening in New Zealand and South Africa and China and Indonesia and Peru, because I have friends who are working there and seeing it firsthand, our colleagues that are working there, and we are constantly in connect with each other.
Dr. Khatib, what was the name of the website where you?
Shoreland Travex is the one that I use.
Shoreland Travex.
Yeah,
okay.
And that's what Medcan uses. That's what we have access to.
Okay, perfect. Okay, great. Do you anticipate that travel within Canada will become more or less difficult over the next 6 months?
It will become more difficult for people who are unvaccinated. So there is a movement that it is very likely that domestic travel it'll become mandatory to show proof of vaccination for domestic airline travel, as well as for travel on plane or on trains and buses. So for those people who are not vaccinated, it may become quite difficult. For those who are vaccinated, I think I think it'll be, as we saw this summer, people were traveling across, domestically. Vancouver was really heavy hit, I think, by most provinces visiting there. And so in that regard, things were booked up, reservations were booked up, cars were booked up. But I think it will become more challenging for people who are unvaccinated.
My partner and I love nothing more than going on cruises. We're both in our late 60s and fully vaccinated. What's your opinion on cruises? Do you think the cruise industry will ever return to the extent that it was thriving pre-pandemic? This is the last of the prepared questions, folks, and then we'll take one question from the audience and then wrap it up. We'll send out a follow-up email with
Yeah.
the link to the YouTube link to the archived webinar, and then you can also respond to that to ask your additional questions, and we'll pass questions.
Yeah. So me personally, I mean, I wouldn't go near a cruise anytime soon. It's too high risk in regards to potential risk for outbreak and potentially, having a full quarantine if you're somewhere foreign and whatnot. That being said, travel medicine is about people's risk tolerance and risk perception. And so currently in Canada, international waters are closed to cruises, and I think they're looking at opening that up in 2022 because the fact that most Canadians will be more vaccinated, and most people doing those cruises, they'll have to have proof of vaccination. But remember, a lot of these cruises are going to destinations where even if everybody on board is vaccinated and has been tested before they come onto these cruises, a lot of them are stopping in countries where people are not vaccinated and potentially where there's a lot of COVID, and they may not be following, precautions like we are doing here. So potentially stopping at these places, getting off board, being at risk, and then getting back onto the cruise boat, you have those exposures then, right? And even, yes, you could test somebody coming right back on, but that's not going to show up for anywhere between 2 to 14 days. So that risk is there. Okay. And so I think the cruise industry will return and it'll be modified. And I know there are cruises that have started up again. They've reduced their numbers. They've had more requirements for vaccination and testing and whatnot. I personally would probably not risk it just yet. The chance of being quarantined on a boat, I don't like the thought of that. So, especially in foreign waters,
There's a great CBC documentary about, I think it's the Diamond Princess and what exactly happened. And they went through kind of, suite by suite by suite and tell the story of the spread of this thing. And it's scary and also kind of super compelling viewing as well, which, okay, the question is about so just a clarification on how to get a consult with you specifically, Dr. Khatib. You call the Medcan number, I assume, like 416.
Yeah, so they can book in a travel consult. If they want a travel consult specifically, they could book in with me. If it's like a simple query and it doesn't require a full travel consult, they can book in through me through YRC. Like they can just request to be booked in with me as a YRC appointment. If it's a full, exactly, the year-round care, I'm usually there 1 to 2 times a week. If it's a full travel consult, we would request it be booked as a travel consult because I'm given more time and I'm given more time to prepare. There are other physicians offering travel consults as well. So if I'm not available, Dr. Dr. Beckeris, they are fantastic. They've been doing it longer than I have. So they'd be able to do it. And we are looking right now at getting more travel docs on board as well, because we know that people are going to be having a lot of questions and it's going to be challenging, and we want to be able to help you guys navigate through that.
Fantastic. Okay. Okay, perfect. So we dealt with questions. So other Medcan Presents other resources. So there are also, I suspect, people on here who are from corporations who have to develop travel policies for their employees over time. Medcan also advises on that and helps with that. And Dr. Khatib is on something called the Medical Advisory Services Team. To contact Medcan's Medical Advisory Services Team for travel strategies or return to work protocols or other occupational health matters, email corporatesales@medcan.com, and that's right there. Future webinars. So the next one, Tuesday, October 12th, how to make everyday anxiety work for you. So many people these days suffer from various forms of anxiety, and many consider the emotion to be exclusively negative. However, it's possible to use the emotion to our advantage. We can harness the power of anxiety to give us energy for motivation and to spur us to achieve things we never thought possible. Plus, how does one differentiate between normal worrying and problematic anxiety? Medcan's clinical director of mental health, Dr. Jack Muscat, provides guidance. And if you have questions you'd like Dr. Muscat to answer, email them to me, Chris Shulgin @medcan.com. So how to register. So Medcan, go to the medcan.com, listen, watch, and learn page, and then find past webinars at Medcan's YouTube channel. I'm just going to quickly go to that page. So let me just share my screen again. And we're on the Medcan site. Sorry, I think I have to actually. So, and what you can do is go to the podcast and webinars, the Listen, Watch, and Learn page, and upcoming webinars are just a little scroll down. So that's it for today. Dr. Khatib, thank you so much. And how can we learn about your dog and COVID study? Is that, so anyway, we'll look forward to that upon its release at some point.
I'll keep you posted. We're still working through some of the ethics board's approval. So we're almost on the cusp of launching this.
Okay. All right. So thank you so much for that. And gosh, you are so busy. And so thank you for your time today. This was
Thank you so much, Chris. I'm happy to help. Take
amazing.
care.
Okay. Thanks, folks.